My biomechanical project is related to chapter 15 of our textbook, and my purpose with this presentation is to understand injury development in a walking lunge movement. This is the movement that I will analyze. Okay, the distance part of the movement should be with feet shoulder width apart, toes pointing straight ahead on both feet, and upper torso is slightly inclined forward. This is a different angle of the movement. In the motion part, the motion sequence, it is important to maintain posture and slowly continue to bend the knees. Front knee travels forward to mid-step of front foot. Weight distribution is maintained, with weight centered more over the heel of the front foot. Slowly lower down to a point where the back knee almost touches the ground. Pause briefly at the bottom, and then pressing through heels come up as quickly as good posture and technique permit to switch legs and start the movement with the other leg. Some common mistakes in the movement are the stride length, stride too short or stride too long. Keep upper torso in a vertical position. Also, during movement may occur a medium motion of knee, especially during eccentric phase and during initial portion of the concentric phase. Another mistake is to compromise posture, such as forward rounding of lumbar and thoracic spine, and also loss of balance. What is the mechanism of overuse injury? Overuse injury is when repeated applications of a stress lower than that required to cause injury in a single application occurs. In a walking lunge, to avoid an overuse injury, aspects such as the alignment of the body is the extreme importance when executing the movement. As mentioned by our textbook, there is a relationship among stress magnitude, number of repetitions, and development of injury. These three factors must be considered when an exercise is included in the exercise routine. Mechanical stresses is related to the forces that act in the body. These forces are responsible for performance and injury, depending how these forces are used. Some of the mechanical stresses suffered will be the compressive force, tensile stress, and shear stress. In a walking lunges, the compressive force is the body weight acting downward and the ground reaction acting upward. Body mass is the primary force acting in the exercise. Because force is equal to mass times acceleration, a heavier individual will need more force than a lighter individual executing the same movement in the same speed. Other mechanical stresses are the tensile stress and the shear stress that happen in the hip, knee, and ankle joints. A combination of these stresses can be seen in the execution of the walking lunge, and an injury occurs when the body suffers from a force greater than what can support. So you may ask, how to reduce these stresses? A systematic training program may be the best way to increase the resistance for injury. The exercise should be overloaded with time, and caution should be used in the amount of repetitions and frequency of exercise. A way to prevent injury in the movement would be to work with the idea of cross-training. In the walking lunges, a way to work with cross-training would be incorporate exercise for the quadriceps, hamstring, and gluteus exercise, as well as balance control exercises. To understand intrinsic and extrinsic factors and the way that they affect injury will help to prevent injury to occur. Intrinsic factors affecting the injury are anthropometrics, skeletal alignment, muscle strength, muscle endurance, joint alignment, bone mineral density, previous injury history, muscle firing pattern, body mass, and psychological factors such as motivation and pain tolerance. The extrinsic factors affecting the injury are the nature of the task, due to the repetitive movement, movement pattern, intensity and frequency of performance, environment, and equipment. The nature of the walking lunges affects magnitude of loading and recovery, and the movement pattern affects tissues loaded. Besides that, intensity and frequency of performance affects magnitude of loading and recovery time respectively. Environment affects magnitude of loading, direction of loading, and friction. And equipment use may affect magnitude of friction and the amount of cushioning. Some differences between intrinsic factors are those that cannot be altered. An example of factor that cannot be altered is the anthropometry of the person executing the movement. Extrinsic factors can be controlled and manipulated. The pattern of movement is an extrinsic factor that can be altered to load the tissues correctly. Easy changes such as intensity and frequency of performance can be changed to reduce injury risk. The environment where the exercise is executed must be clean, not slippery, wet, or with other equipment along the way. Pay attention in some details will be fundamental in reduce falls and injuries when performing the exercise. The equipment used to overload the exercise must be introduced progressively, and the footwear chooses with attention because of the magnitude of friction and the amount of cushioning necessary to execute the movement. An example of how footwear is important in a walking lunge is to compare the movement if only socks were worn. Since the risk of injury can be considered an interaction between intrinsic and extrinsic factors, the most extrinsic factors altered. Since the risk of injury can be considered an interaction between the intrinsic and the extrinsic factors, the most extrinsic factors altered to intervene and effectively reduce injury risk, the better will be the results reached. A correct intervention may reduce the magnitude of stress, frequency of stress, and tissue's ability to withstand stress. For each one of these categories, I will mention one research, and you can see the reference on the bottom of the page. Magnitude of stress. Walking lunges are a lower extremity exercise considered to be a functional exercise because its execution approximates the movement pattern of common daily activities, trains several muscle groups at the same time, and doesn't need specialized equipment. The lunges may be used to correct strength differences between left and right muscle groups due to the asymmetrical nature of the movement. Also, the study found a greater mechanical demand at the hip during forward lunge when compared with lateral lunge. They found that the forward lunge would be more effective exercise for improving hip extensor function. Because forward lunge targets the knee extensor musculature over a greater range of motion, it generates greater mechanical energy expenditure. The frequency of stress in a quality observation of the anterior lunge reveals an exercise that largely involves the ankle, knee, and hip extensor muscle groups as a prime movers in the sagittal plane, with frontal and transverse plane muscles group serving as stabilizer. The results show that anterior lunge is a hip-dominant exercise and that increasing the external load during the exercise increased the ankle and the hip contribution, but didn't have the same effect on the knee. To recognize the frequency of stress in each tissue will help to prescribe the right amount of exercise. And the last one will be the tissue's ability to withstand stress. Eccentric exercises have been used for prevention and rehabilitation of injuries, and lunges have been used as one exercise because of his characteristic of eccentric contraction, especially for the hamstring group. The study states that due to the complexity of lunge movement, it is difficult to determine whether the hamstring group are acting eccentrically during the lunge for a qualitative view. They show that in a forward lunge, the eccentric activation of the hamstring group happened only 19% of the lunge cycle. Rectus femoris was eccentrically activated during 54% of the lunge cycle, and the lateral gastrocnemius was during 61% of the lunge cycles. Another interesting point is that the three muscle groups are active to some degree throughout the lunge cycle. This characteristic may increase the tissue's ability to withstand the stress imposed by the movement. These are my references. Thank you very much for your attention and time.